Good morning, everyone. I was waiting for Dr. Adams from Oh, she's on. Okay, so I want to go ahead and get started. Good morning. Welcome to the week before Christmas. I'm Christy Camlin, the director at the Cole County Health Department. Again, this week, we are still seeing numbers that are on the downward trend, and we're still very cautiously optimistic about those numbers. We were happy to not see a huge spike from the Thanksgiving holidays. And we want to emphasize to everyone that it's not time to let our guard down, and we need to keep doing those preventative measures that we have been doing that have got us thus far. We want to keep, limiting our gatherings, limiting our size, washing our hands, social distancing. We know that's very important. And social distancing is not being within 6 feet of someone for more than 15 minutes. We need to wear your mask when you can't social distance, keep washing hands, using that hand sanitizer, cleaning those frequently used surfaces, all the things that have got us this far. We want to keep doing them because we are cautiously optimistic that our numbers will continue to downtrend. I know that as we are moving through this pandemic, the next step has been the vaccine, and we've all been hearing a lot about the vaccine. And we're happy that it is now here in mid-Missouri, and we're in phase 1. So I want to talk a little bit about the phases and perhaps the timeline and try to give you some information. And then Dr. Adams is going to talk about if you have questions about your status and what you should do. So I'm going to share my screen real quick. I think that's going to be a very easy way to show you a new website that DHSS in the state of Missouri. So it's covidvaccine.mo.gov. As the governor spoke about it yesterday, Mo stops COVID. So on this website is where the state of Missouri will put out information about which phase we're in. We'll move through the phases as a state. And on this site, people can get the facts about the vaccine if you're a resident, if you're going to be a vaccinator. And this will be a very important website to bookmark and be able to watch the state status here. What I want to talk about today is towards the bottom of the page. It's this vaccine availability. So this week we are in phase 1A. The healthcare workers are starting to get those vaccines. They're starting to get them in. The supply is very limited. But as they come in, healthcare workers are number one, and they're getting those vaccines now. Also, the long-term care facility residents and staff nationwide, Walgreens and CVS have the contract to be able to go in and give those vaccines to long-term care facility residents and staff. And we are also reaching out to all those facilities to make sure that if they don't have that contract or something set up with that contractor, that we can help them to facilitate getting those vaccines for the residents and their staff. Right now at the health department, we don't have the vaccine, but we will help them, get with the partners that they need to be able to get that vaccine. There's 2 vaccines right now, and then there might be a third. Right now, it's the Pfizer vaccine, the Moderna vaccine, and then we hear there will be coming one from AstraZeneca. So during phase 1B, which will likely be at the late January, early February, again, depending on the need and the supply and the demand, that is when the health department and other healthcare partners will get involved with getting the vaccine, and we will start, vaccinating the high-risk individuals and first responders and essential workers. So more information, will be shared when we know it. It's just very early in the stages, but we want to share that information with you. We also have put a COVID vaccine section on our website, colehealth.org. But if you want to keep track of what is going on statewide, this statewide covidvaccine.mo.gov is going to be the place to look. So I'll stop sharing as long as everybody's had a chance to look at the website and bookmark it or write it down. That way it's just going to be full of great information. And then I will go ahead and transition to Dr. Adams and let her talk about maybe, if people have specific questions or what it means for you. Dr. Adams.
Sure, Christy, thanks. So We are so excited and optimistic because this week we began vaccinating our patient-facing healthcare workers. We started on Tuesday, as many of you saw, and have continued every day. So right now, we're feeling very confident that we're reaching all the frontline healthcare workers in our hospitals who want to be vaccinated. And the next thing that we would like to do as a community is start reaching out to the healthcare workers who are patient facing but don't work at a hospital. And if any of them are interested in being vaccinated, we would like to, in the next few weeks, start to reach out to them and start to offer them the opportunity to be vaccinated, because they do fall into that phase 1A, that they're a patient facing healthcare worker. Now, as we're moving into the phase 1B, as Christy showed you on the slides, and reaching out to educate the public about their need for being vaccinated, and if they want to be vaccinated, of course. We will first be looking at folks who are high risk because of comorbid illnesses. If they were to contract COVID-19, they would be at higher risk for having an adverse outcome or having a very severe illness. That group of people is going to be offered the vaccine first before those who are considered to be otherwise generally healthy. And also people who are in an age group above the age of 65, because they've also been shown to have worse outcomes when they do contract the virus. Also, of course, we want to reach out to our first responders and make sure that we keep them as safe as we can by offering them the vaccine if they're interested. And then other essential workers as defined by the state of Missouri. And as we're moving into that phase 1B, the state will give us direction on when it's appropriate to move into phase 1B. So I know they want to hear from us as we're moving through phase 1A, and we feel that we've reached everyone who wanted the vaccine in the phase 1A group, and then they'll let us know that it's appropriate to move into phase 1B. So right now, all that is in the planning stages, and how we're going to roll that out is still in the planning stages. We're talking about it every day in a coalition between all the hospitals and healthcare facilities in town, how we're going to make this happen. I don't have a final plan for you, but it's definitely being talked about on a daily basis.
Thanks, Dr. Adams. I agree. It's going to be a big initiative, but with everybody involved, we will tackle this issue too, and we'll make sure that everyone gets the vaccine that wants it and needs it. So Dr. Haight from Capital Region.
Yes, thank you, Dr. Adams and Christy. The three of us, as well as Dr. Sullivan, JCMG, as well as other county health departments across mid-Missouri, have been meeting for the last 6 to 8 weeks, discussing vaccines and implementing plans on initially healthcare workers. Our next phase is trying to make sure that we're reaching out to small groups, and both St. Mary's and Capital Region have started to do that, of healthcare workers who are in small groups and who have not had access to the vaccine. We will continue to be working through that over the next few weeks to make sure everyone who wants to have a vaccine, who's a healthcare worker and front-facing, is able to get one. So we will continue to work on that. One of the questions that has arisen is, when do I get to take off my mask, and when do I get to stop doing some of the things we're doing? Well, right now, we're early on with the vaccination. We still see COVID going on within our community. And I can tell you, Dr. Adams and I and Dr. Sullivan are all very happy that our numbers have gone down in our community. And we thank everyone in our public for having smaller get-togethers, for staying home when they're sick, for washing their hands, doing all those wonderful things. So we thank you all, and we hope that you will continue to do that over this Christmas season, Hanukkah, as our new year approaches, to again have our smaller get-togethers, continue to do what we're doing. We want people to continue to wear the mask when they're out and about, continue to wash your hands. As a guess, we're guessing that as the population gets the vaccination and as we get smaller and smaller numbers, we're talking about probably summertime that we'll be really talking about what can we do at this point. Do we have low enough numbers within our community to say that we can take a different approach to what we're doing now? But right now it is too soon to make changes. We, again, are just getting the initial doses of vaccine to our healthcare workers. So we need to continue to be ever vigilant, yet cautiously optimistic that we do see light at the end of this COVID tunnel. Thanks.
Perfect. Thank you, Dr. Dr. Adams and Dr. Hay, did you want to comment on the status of the hospitals right now? I know that we've had that question before, and we didn't touch on it today. It's up to you.
Dr. Adams,
We're doing really well. The numbers at the hospital are about what we would expect for this time of year, and the number of people who have an active COVID infection who are still under quarantine is also lower than it's been over the last month. So things are looking good. And again, that's all attributed to the behaviors in the community. You are the ones who have kept everyone safe. Your behavior is keeping us safe. So thank you.
Right, and Capital Region is a similar thing. We're seeing the usual number of patients we would have at this time, and our COVID numbers certainly are not where they were a month ago. And what we are hearing is on either side of the state, they continue to have large number of cases. So again, it makes it ever important for us to be really careful on our get-togethers, make sure that we're staying within the group that we are usually with during this time.
Thank you, Dr. Adams and Dr. Hay. I can echo your sentiments that we need to keep doing what we're doing. This is a good path we're on. So Ron, did you have anything to add from JCMG?
I do not at this time. Thank you.
Thank you. Mayor Turgeon, would you like to say a few words?
Yes, thank you. And appreciate everybody coming together and being unified with our hospitals and getting this message out. I know that this is something very important, and I will certainly be listening to our doctors as they have spoken today, and encourage you to share this with your friends and families and coworkers. And as we approach the holiday shopping season, I also want to mention that holiday shopping doesn't have to be online. We can still support our local businesses by shopping virtually. We can do low contact shopping methods like curbside, takeout, delivery, shopping by phone, email. There's so many ways that our local businesses will still work together with shoppers for the holiday season. So find those off-peak hours to do your shopping and do your curbside pickup and delivery if possible, and especially in our local restaurants, space out. So it doesn't mean that we're not going to support our local businesses. It means finding ways that they'll work together to have the lowest contact possible as we get through these final days of our Christmas shopping season, because we know that there are some things that we do not want to regift, and this virus is one of them. So in the spirit of holiday giving, I think this is the best gift that we can give one another, is the gift of caring about those that are around us, and knowing that we have things that we can do and these habits that we form that we can share that really mean more than any gift we could ever think about giving all of our community to be safe and healthy, as our friends and family around us. So I want to reiterate our city and county advisory that we put out. That is still just as important as ever. In fact, the Capital Region Board of Directors just endorsed it yesterday, and reminding everyone, stay home if you're sick, physical distance, avoid gatherings, wear your mask, encourage telecommuting in your offices and work, and your low contact shopping methods and spacing out at your restaurants. This is extremely important. So remember, don't give it and don't get it. And we can do these things and work together. And during this season, as we get close to Christmas, please continue to listen to our doctors and every word they've said today, and continue to make those habits and precautions. So thank you again.
Thank you, Mayor Turgeon. We will not be holding a press briefing next week due to the holidays. So we just ask everyone to keep doing those preventative measures and have a happy holiday season. So at this time, I would open up for questions, or like Dr. Sullivan, if you did have some comments, anyone else who had a comment or a question at this time.
Hi, this is Jessica with KRCG. I have a question for Dr. Adams. I think you mentioned earlier that you have almost everyone in your phase 1A group vaccinated. How many people is that? Or did I hear that correctly?
We are, so just to be more clear, I guess, we are feeling confident that everyone who has wanted to receive the vaccination, who is in the phase 1A in the hospitals, is had a chance to present. And I know that there's still some people left who still want to come and get it, but we've seen the volume slow down. So we're under the impression that we're nearing the end of vaccinating everyone in the hospital who wanted to be vaccinated.
Okay, thank you for that. And then just since I have you quick, I know there's a redistribution process between St. Mary's hospitals and other hospitals within our region. Are you able to share what hospitals you guys are working with to help get them the vaccine?
I'm not sure if I'm allowed to share that, so I'm going to hold off. Sorry.
Okay, no, totally fine. I just thought I would ask just in case. And then, sorry, one more quick question for me. This one is kind of, I guess, for anyone really on the call. Obviously, we just got the vaccine and it won't be available to the public until late in the spring is what we're kind of been hearing. But does anyone, are you guys like working on any sort of like promotional campaigns to encourage people to take the vaccine who maybe are kind of on the fence about it?
So as far as the state health department and the local public health agencies, there is a large campaign that is being conducted by the state, and the materials will be at that website that I showed earlier, covidvaccine.mo.gov. So the state of Missouri is engaged in that, and we will be taking our direction from them. And we also have a local campaign that we'll probably talk about all things COVID, and we will include vaccinations with that campaign as well. And St. Mary's and JCMG and the Community Health Center and the city and the county are all involved in that educational marketing campaign. So I don't know if anybody else has anything to add, but I know that there will be a lot of materials coming out from many fronts about the vaccine and trying to get the facts out about it.
And I know the different medical associations in the state, as well as the Missouri Hospital Association, are working with the governmental agencies as well as amongst themselves about other approaches that we can do to encourage the vaccination when it is available to the general public.
That's right. And that, like I said before, that website will be very critical in showing which phase we're in. Is the state ready to move to the next phase, and letting people know when it will be available for which groups.
Awesome. Thanks, everyone.
Thank you, Jessica. Does anyone else have any questions? Well, thank you everyone for joining us today. And like I said, have a great weekend and have a safe and happy holiday season. Thank you. Goodbye.